Hi, everybody. Dr. Dawn and Ginny of the Thought Word Academy, and today I am here with Ginny Viafore, who is a neurodevelopmental specialist and is here to answer some questions to help us understand a little bit more about what she does and how she can help the community of Rising Tide women. Just to remember, for those of you who might be your first time here as well, Rising Tide is a combination of women, of providers who are helping, and men too, I'm sorry, men and women who are helping women at every stage of their life be able to get the support that they need by a trusted group of individuals who offer their services for different areas and different functions of life. So I'm so excited to have Ginny here today. We've known each other for many, many, many years, and she's just a wonderful human being and an incredible person. And I'm just so excited to share her talents with you today. Thank you, Ginny, for being here.
Thank you, Dawn.
Hey, so I'm just going to jump right in. I came up with some questions I wanted to ask you, so I'm going to read them. My glasses on, and want to share a little bit so people can understand more about what you do. So you have a beautiful philosophy centered on a neuro-affirming care and finding joy in connection through approaches like DIR and Floor Time and the PLAY project. For a parent whose child is currently struggling with sensory overload or communication barriers, what does meaningful growth through play actually look like in day-to-day life?
So meaningful growth, for a client that I'm working with, oftentimes, we're really trying to figure out what the parents and the family are struggling with initially, whether it be, engagement, communication, regulation, and then we would kind of design goals and programs around that. And it's a very parent collaborative approach. So I would really be making sure that the family is learning all these tools to engage or regulate their child based on their goals. So it's not just me coming in and working with them. I really want to make sure that you guys understand how to work with your child and also are able to implement it. So oftentimes, like, I might ask you to play with your child, and observe, and then give some coaching or feedback based on, what's happening, so that, the family's really learning how to engage and collaborate. So often, like, a meaningful goal, it's hard to always identify what exactly might be a meaningful goal be, but it might be like, now I learned how to play and connect with my child. Like, I have this ability where I know actually what to do with my child. So sometimes, like, I get parents that are like, he's jumping on the walls, we don't know what to do. So, like, I'll be observing them and I'll watch the parents interact, and then I'll give them pretty specific feedback on how to play and engage and what that child's looking for in their sensory system. So they'll have, activities that directed to help self-regulate that child. So it's really just empowering the family. So, like, for that kind of goals, it would be like they have these tools and they have that understanding of what the child needs at these certain moments when they're struggling, versus kind of just, not having abilities. Or, like, even with, like, speech, some of these guys are nonverbal. So we would give you suggestions on how to incorporate and get more language out of the child, or being able to read their cues to get them, using their language more appropriately. Or even kids that are verbal, but they're not very some kids, like, they might not be functionally verbal, or they might be verbal, but they have some lacking skills. And what I would do is really assess where they are developmentally and give the family specific activities to do to kind of move them up that developmental ladder, if that makes sense. So it's all like, all the goals, meaningful goals would be like, are they hitting, are they here? And then like maybe next month we see them, they're hitting higher developmental stages. And that's kind of what we like to see, is like, now they're, maybe they're moving into a higher developmental stage versus when we saw them last month. Or, like, the kids, now the kid's pointing. So, like, I really try to gauge where they are developmentally when we're writing goals, and kind of help guide the parents to work on those developmental activities, if that makes sense.
It does. I mean, and that's amazing, because in many years that I've been doing this, I have come across several clients who've had challenges with their children not knowing and trying to figure something out. There's, there's research out there, there's some things out there, but it's hard, and it's hard when you're trying to juggle like taking care of a child, and often they may have, you know, a couple children at least, you know, and now you have one that seems to need so much more time and attention. And then you also, you know, may have to work and, you know, take care of a home and all these other things at the same time. So I think you being able to come in as a guide and give them some direction and, you know, help them figure out what to do so that they can be more self-sufficient. It's not like, okay, you come in and play with my kid. It's like, come in and teach me how to, you know, how to do this and how to be able to communicate better and help them develop. I think it's fantastic.
It's very dynamic. Like, no, I never have like one, maybe one person has one goal, but then the next time I come in, they'll have 5 or 6 different areas that they're struggling with. So it's very dynamic, and I'm very like, like I'm pretty flexible. So I'm like, my last case that I just went to, I stayed longer because they were having trouble at the grocery store. So like we basically made a to-do list for these 2 children on how to deal with both of them, because one's autistic and one has ADHD. So like that mom could kind of go to the store with these 2 children, and she sent me a text and a video of them at the store yesterday that they were there. So just empowering these parents to be able to just having these tools that they can use to go out, or hey, that didn't work, which is fine. Sometimes I'm like, oh shoot, that didn't work, let's try something else. We're able to kind of mold and work with the parents to find, make this feasible. And then it's also that's nice is because like I don't always need a diagnosis. I just started with a 13-month-old that was walking on his toes, and it was I work with the older one, and I'm like, oh, he's on his toes, and she's like, yeah, but the doctor said he's fine. I'm like, well, it is, but that's not typical. So we were doing some activities, and we got the little guy off his toes within a month. So like sometimes it's just like little things that our parents are a little bit concerned about, but they don't have a diagnosis, and then we can just kind of address them pretty quickly, so that they're not coming, a problem later on, if that makes sense.
For sure. Um, so the other thing I wanted to ask here was, you have a lot of, your background, a lot of work with motor development and reflex integration and, what's called the handle screening. Maybe you can talk a little more about that. But often parents see that on the surface, when it's actually a sensory or if it's a neurological need that's underneath. Can you give an example so people can understand a little bit about the child's sensory motor profile completely and how it changes and how we understand to support that behavior?
Yeah, so like I always try to explain to people that the body's like a system, so everything has to kind of work together for the body to be working optimally. So like we think of it like as like a building. So if the building has a faulty foundation, or the sidewall is kind of crumbling, the building's not going to be straight up. So like what the sensory motor development, we're really looking at these like foundational issues so that they're able to strengthening up these foundations and learning so that they're able to basically learn from their environment. What I want these kids to do is just kind of be able to kind of take in information in a more typical way so that they're able to go to school and they're picking up, or they're able to read more fluidly versus like, struggling with needing tutors and everything. So like, as I said, we really look at this at these base levels. So what's these underlying causes? So for instance, like I have one of my friends who's a little boy, he's got dyslexia and ADHD, and I guess he's 8, and he's been lately just falling. He can't, every time he walks, he just falls flat on his face, and they're like, oh yeah, it's just because of his ADHD. So they're medicating him for the ADHD, which is fine. I was like, well, I was like, is there anything else going on? And she's like, he's not able to read. He's 8 years old and he's reading at a kindergarten level. There's no reading. And I'm like, well, have they ever looked at his visual tracking? Like, can his eyes work together? And she goes like, no. And I'm like, well, if he can't see, he can't read. And she's like, oh, so we actually ended up looking at his visual tracking, and his eyes were jumping. Well, they were trying to track, and they were just literally jumping. And then when I tried to put
That's
them,
usually a typical symbol,
yeah,
a sign of dyslexia, isn't that? That the eyes do that.
for sure. But it's like, because they were just looking at these labels, they weren't really addressing the underlying problem. There's that, the underlying issue with dyslexia is that their eyes aren't tracking, and then both sides of the brain aren't working together. So there goes a kid that is falling because he's not getting the right information from both sides of his brain. So anyways, like we just like, with that, like, I haven't worked with him yet, but like giving them activities to work both sides of the brain and get the eyes tracking, hopefully like that would, get this kid reading and not falling whenever he's, running into the wall because he can't see, So it just was funny, like, we really try to look at these like versus because he's been in tutoring and he's been in special ed for his whole life and it's not working. So I always say, like, why don't we fix the underlying problem so these other therapies actually are more effective? Like, it's not saying that they're not needed, but they're, we're not hitting these roadblocks where like nothing is working, that makes sense. And then like, I have another little guy with like a severe level 1 autism, and level 1 autism is, a lot of people have a hard time with these guys. So really severe behavior issues, and everyone's like, oh, he's got behaviors, he's swearing at you, like running around, you can't be around other people. So like, I told mom, I'm like, his nervous system is so on fire that he can't, it's so dysregulated that he can't allow people to move in his space. It's just getting him overstimulated. So what we've been doing is gently rocking and getting the system more organized so that he can kind of tolerate movement. And lo and behold, we have a little guy now that can like functionally play. He's making a big boat scene and an airplane scene. And now yesterday he was able to verbally explain to me how he's upset that he has other brothers and sisters and he doesn't like that they're in his space, and like high level problem solving, which was unheard of with a child, this little boy. So, and the mom even said like the school was going to put him on all these behavior plans for this obsessive speech, like he would swear and make weird noises, and now he's on like, he's had a perfect month, like no more behaviors, and they're like, oh yeah, whatever we've done had fixed it, because like he doesn't need all these like behavioral issues because his nervous system was just so jacked up. So this
how long did it take to be able to get from that point of understanding what was going on to, the work that you did with him?
I started with him in January, the end of January.
Okay, so like 6 months.
Yeah, I usually recommend 6 to 8
months.
Yeah, but like kids on the autism spectrum usually need a little bit more support. But yeah, this guy responded really well, and the mom is very good. Mom was very willing to work with him and do the program, and we did recommend stopping all other services because they were overstimulating him. So I think it was just like, it was a good case. I mean, we're still working with him now. We want to work on higher level things. So like, as I said, now that he can regulate and problem solve, now mom wants, reading, because he also has dyslexia. So now our new goals we have different goals, and that's kind of where it's nice. It's fluid. Like, okay, now we want a kid to, we want more things now, which is, that's what I find is like, okay, we have this, now we want this. So, yeah.
And I think that, that's so lovely, because if you want to have, I think all parents, we all want, we have goals for our kids that we want to see them, reach, whether it's just general milestones or, the goals and dreams they have for themselves, but to be able to not feel like you're stagnated in one goal, but that you keep increasing and being able to move to the next one. I think that's phenomenal. And they must be so, so excited, to be able to see those changes and to understand, I think as a holistic practitioner myself, it's always frustrating when I see people going to a lot of allopathic medicine and seeing that they're only dealing with a symptom, rather than, the causality of it. And to be able to really delve down and say, okay, well, we can just keep trying to take care of symptom after symptom, but why don't we figure out where those symptoms are coming from first? So, I think being able to, to understand that and say, okay, yes, maybe, the answer isn't, put this child in a vacuum somewhere where there's no stimulation, but rather figure out, how to get him to be able to handle, what's going on around him, for sure. So, I think it's brilliant work that you're doing. And, I know so much that there'll be many people will be, excited to learn more about what you do and what you offer. And before I go to the next question, I wanted to ask you, is all the work that you do, is that only something you can do locally, or is there help that you can give to parents, who aren't living in the area that you're in?
I I work with a couple in Australia. So yeah, we can do it. They said this is like a home-based program. So, I can assess the child and the family, and, we can make, developmental goals and play goals, and also sensory motor program that I can train the family on. So the whole point of this kind of program is for the parents and the family to be able to implement it. And depending on the families, like the family in Australia, I see every week. I saw him every week for a year. Now it's every other week. And, it's just more of having this person in there watching and coaching and giving them feedback and being like, oh, try playing it this way, try playing it that way. And then, like, as this kid progressed and, now he's a fully functioning verbal 4-year-old, but like now we're having more sensory motor challenges. So now we've shifted our approach to more hitting these sensory challenges. So yeah, we can definitely, I feel like, virtual works actually honestly sometimes even better because the parents are really having to do the homework and do the work and do the engagement. So like I love working virtually, but yeah, no, sometimes, maybe sometimes people just need a couple, 3 or 4 activities to help regulate their child, or like developmentally they're here, work on these skills, and they don't need me to come in and work with them every week. They might need just a couple of sessions, and that works well virtually also. So
Fantastic. That's great news. So my last question for you today, we could just keep doing this all day, but we'll last one more today, and then we'll continue on another one, I think, because there's so many questions I have. And I'm sure there'll be people who will write in with more questions that we'll need to ask as well. So you have 25 years of experience, spanning both applied behavior analysis and developmental relationship-based therapies. And it gives you a very, well-rounded view of child development. And I wanted to know how, that journey over time of all the things, your experiences and what you've learned, how that has shaped your current approach that's very holistic. And what's the number one thing that you wish that parents knew about partnering with a specialist to help empower their child?
well, I think for me, like my journey, I had a lot of training before I had my son, and I was, into the ABA field, and I always was looking for something different and looking. Then I got into the handle approach, which is like that neurodevelopmental approach. And then I did the play project, which is developmental. But, I was utilizing all these principles and working with the families, but it never really feel like I was really helping to the amount that I felt like I should help. I wasn't really connecting with the families and really, getting as close, supporting them. I was doing all the work, but there was no collaboration, I guess, if that makes sense. So once I had my child, and then I had a child with pretty significant special needs, and that's kind of my journey, is that I think he was gifted to me for, so that I could help people. But like, he was very, very challenging. And, I had to do nutrition. We did the DIR approach with him. And we made progress, but we never made enough progress, and then I fell into the reflex integration work. And actually that's what shifted him into, we've got more and more progress. But then I had to do a behavioral approach to support my child. And, so I learned all these different approaches to support this child as he progressed and now as he developed. And I feel like that was like invaluable, because now I can really look deeply at a child and be like, okay, this is where we are now, but maybe next month we're going to be needing behavioral support, or maybe this month we need nutrition. So I'm like able to really mold it for where the child is and the family is right there. And then I also now, because I've had my own child and I've dealt with difficult situations and difficult not knowing how to work with my child and struggling with that trauma piece, I can connect with parents and I can be like, oh yeah, I've gone through this with my son. So I understand it, and that empathy and being able to share my story has really allowed me to really genuinely understand where these parents are coming from. Because like as a professional, if you've never had a child with special needs, you just have no clue how much these people are dealing with. So I feel like that's really given me just invaluable experience and like, understanding. And I feel like that's really shifted my practice, just that in itself. And then, yeah, what was your other question?
The other one was if there was one thing you would like parents to know, about working with a specialist like you, like what would you like them to know?
I think like, the difference between going to a clinic, and I was talking to one of my mothers today, a clinic versus going out like to a specialist is a clinic, they're not really, it's kind of an in and out. They're looking at it in one lens, you're an OT, you're looking at it on this lens. You're not looking at it with all these other lenses. You're not seeing what's happening in home. You're not seeing, the nutrition. So like, when you look at a specialist that's looking at all these different areas, you're getting so much more, a deeper understanding and a really much deeper, viewpoint on what's going on with your child, because I can tie in so many different areas, because versus just one thing. And then the other thing is like when you're working in a clinic, not that it's anything, they're not really, it's kind of an in and out, you don't really getting that strong relationship and that support, or being like, oh, you're really struggling with this, I'm going to go home and I'm going to figure out a plan to support your child. Like they're not just, a clinic-based therapy will probably just be like, all right, we'll see you next week. Like usually what I would do is I would make, if a parent tells me these 4 things they're struggling with, I would have a written note with specific suggestions and activities to be doing after the session, so that it's really targeting and supporting that family. So it's a little bit, a little bit different. Of course, clinics are wonderful, but like, that's different. And then the other big difference is like, I do feel like, in my practice, and I've seen this a lot, is that clinic-based doesn't translate to home. So you can get all these like wonderful ABA team and they're doing all these wonderful things in a clinic, and then the child is at home and he's falling apart, he's struggling with his sensory system, he's not using those skills. So like really I tried to like be a bridge for, these services, so that we're really able to bridge it into the home, so that all these like, wonderful things that maybe the kid can do there is happening at home too. And sometimes the parents just don't have that language. Like, I don't understand how to work with my child, but an ABA therapist would. But I'm like, okay, so then I'm going to teach you this language so that you can do it at home. So it's a little bit, and then I think that's where the nice thing about working with somebody like me is that, we're going to really make sure that you guys have these skills so that you can do it there. So.
Yeah, I mean, and I think just for the example you gave before with the child who feels overstimulated by the other children in his family, that's not going to happen when he's in the clinic. He's, one-on-one. It's a very different environment. So, you can't really have a good analysis of what, you're meant to be seeing, because you're not seeing it and it's not home. Right?
Yeah, like I have a little 4-year-old I work with autism. Supposedly he's doing amazing in ABA, and they're about to discharge him, and I'm at home and the mom's like, he doesn't talk and all he does is make weird noises all day. Like, how are they going to discharge him? Like, we don't even know what he can do, and it's like, so like our job, like, I'm like, okay, that's great that he can do these great skills there, but like at home he's a sensory system is a mess. So, we're focusing on getting him regulated. And then I actually had to go to the ABA school and teach them activities to regulate this child so that he's not dysregulated at home. So it's just like, I really want to make sure that it's collaborative so that the parents are being heard, like, okay, well, he's not talking at home. So what's going on? How are you guys working on speech at ABA? Okay, so now we're going to translate that to home and teach those parents those skills. So I don't know, that's kind of how I try to make sure that, we're all on the same page. If that makes sense.
Yeah, fabulous. And it's nice to know, like, to feel like it's a team and that you're on their team and that you're going to, be a liaison as well as, help be proactive, and be the voice for them, when they don't know how to voice the challenge.
Exactly. Yeah.
Yeah. Well, listen, I thank you so much for your time today. I appreciate it. I know you're very, very busy, and we had to reschedule ourselves between the two of us many times to get this to work, but we did.
Yes, thank you so much.
And I hope that, oh yeah, of course. And I hope that we'll continue on. And my goal is that, everyone should learn a little bit more about what you do. They can, obviously go to, if they've, come to this video, it may be just directly from the YouTube page, or they've come to the Rising Tide website and they've clicked on your bio, which I'll, make sure I add at the bottom of this video as well. And if somebody wants to get in contact with you and see what you do, how do they do that?
They can go on my website and send a message, or they can just text me on the phone. Usually, what I've been doing is just free. I'll talk to them on the phone for free. And if they're interested, but they're not sure, we can do like a free 15, 20-minute consultation where I can take a look at the situation with the family and the client and see, then the parents can decide whether or not they, want to start services or not.
Fantastic. So I'll put all that at the bottom of this video as well, so people can get in touch with you, or they can also go to my website and find your bio there and see more about what you do. And hey, listen, that's what we're here to do, to provide that help and that support, because many people are out there and they're struggling and they don't know what kind of help they can get, and that's why we've created this collaboration of women all together, or men and women all together, helping women who are struggling in these areas, and who just need to know, like, who can I go to, who can I trust, who's helpful, and as I said, you and I have known each other many years, and I think what you do is amazing, and I've seen you go through your own challenges with this as well, and all the strides you make, and and I think a lot of people don't realize too that the support is not just it's for the kids, obviously, but as you said, having been through what you've been through, a lot of times I've seen, especially in my couples counseling, when a couple may have a child who has special needs, that not always are both parents on the same page,
Right.
and one wants to do a lot of work and holistic work and figure out what to do, and the other one's either frustrated or doesn't believe in it or is ready to give up or just wants to medicate the child and be done with it, or whatever it looks like, so I think that that's a very strong piece as well, to know that there's somebody out there that is in alignment with what you want to do for your child and can help you and give you those tools, and to give you that support, so you don't feel like you're alone in the struggle of trying to make it work, and trying to help your child succeed. So bravo to you and all that you do. I appreciate it.
Thank you. So nice to talk to you.
You as well. Thank you again, and I look forward to chatting with you again soon. Take care.
Sounds good. Bye now.